Hey guys, this is a high yield COMLEX level 3 question. I just finished taking the exam and I'm making these videos because I'd like to improve on how I deliver information. I know it needs work, but hey, if nothing else, these questions are as close to the real thing as it gets. And you can fast forward to the end for the answer. So let's get started. A 44-year-old woman presents to the office with a 3-month history of unintentional weight loss, low-grade fevers, and night sweat. She is an immigrant from Afghanistan and reports 2 sexual partners in the past 6 months. She has received standard required vaccinations prior to coming to the United States 4 months ago and received the BCG vaccine. The test most likely to reveal the source of this patient's symptoms are. Take a second, make a pick, and let's go through the choices. Choice A, tuberculin skin test. Wrong answer. This is wrong for 2 reasons. First, the patient received the BCG vaccine, so the tuberculin skin test will give a false positive result. Second, this is a screening test that would be for asymptomatic patients. This patient is clearly not asymptomatic. You should know the people in the United States, Western world, they do not get the BCG vaccine. It is routinely given to newborns in high incidence tuberculosis countries, so Asia, Africa, Central America, generally those are patients that you want to think about. Choice B, HIV antigen antibody combination immunoassay. Wrong answer. So given her symptoms, 2 sexual partners, screening would be medically indicated, but it doesn't really address the symptoms that she's having. There's better choices. It's important to recall that HIV screening should be provided to everyone between ages 13 and 64, at least once in their lives. High-risk screens are every year. Pregnant patients should be screened each pregnancy. It is interesting to note, generally when you say high risk, it's people that have IV drug abuse or people that are men having sex with men. But high risk is also a patient that has had more than 2 sexual partners in 1 year. It's just good to know. Choice C, lymph node biopsy. Wrong answer. This would be the best initial test if you were thinking about lymphoma. The patient does have B symptoms, fever, night sweat, weight loss. But the question doesn't mention swollen lymph nodes like you'd expect. There's no hepatosplenomegaly. It's just not the best choice. You can eliminate it. Choice C is wrong. Choice D, interferon gamma release assay. Wrong choice. It is a better choice than A, but it's still just a screening test. It wouldn't differentiate between latent and active infection. So even if you did have a positive IGRA, that would still necessitate diagnostic steps. So that leaves us with choice E. Correct answer. Chest x-ray with a sputum culture is the gold standard for diagnosing active tuberculosis. Remember, active tuberculosis is different than latent. It's highly contagious. So the next step would be airborne precautions. It could also be called respiratory isolation or negative pressure isolation. Right therapy for 9 months. The side effects of those medications and how they're administered, that's all high yield, but just to stay concise, we'll save that for another video. It's noteworthy to say one other high yield point. What would you counsel the patient on? In this case, this patient would require isolation for up to a month while being treated and until their symptoms completely go away and they have negative sputum tests. So they're contagious for 2 to 4 weeks after the initiation of treatment. And that's it. I hope